Good morning, everyone. I hope everyone's enjoyed the morning so far. So I have the pleasure of introducing Dr. Alan Chase. He is a person with visual impairment. He began working with students with visual impairments in 2005 on college transition and access through temporary state service in the not-for-profit sector. He has served as a teacher, a school administrator, and an injunction with the faculty member in North Carolina and Tennessee. While in Tennessee, Dr. Chase supervised deafblind interveners and teachers of students with significant disabilities, including between the School of Deafblind Project. He has been published in the Journal of Visual Impairment and Blindness, and previously, Dr. Chase served on the board of directors of the North Carolina Association for Education and Rehabilitation of Blind and Visually Impaired, as well as the chairperson of the North Carolina Conference on Visual Impairment and Blindness. Presently, he serves on the Association of Education and Rehabilitation for Blind and Visually Impaired Accreditation Committee for Organizations and Schools. And in 2008, Dr. Chase established a not-for-profit organization for youth with visual impairments focused on transition. Currently, Dr. Chase is also a consultant for the visual impairment at the NC Department of Public Instruction. His doctoral dissertation focused on educational policy as it relates to schools for the blind. So welcome. I'm very excited to hear your presentation. Thank you.
Thank you. All right, good morning, everyone. All right, so just so you know, I'm going to walk around. So thank you for that great introduction. That's, I've done a lot. Yes. So I think first thing is, so I do have a visual impairment. So if you have a question or anything, if you raise your hand, I may not see it. So feel free to just throw something at me. Just please don't make sure it's very hard. A nice squishy ball or something may work. But seriously, if you have any questions, just say my name and I'll stop and we'll talk. Okay. I think this is really important. One of the reasons why I wanted us to have a session on collaboration is because specifically around students with deafblindness, there are so many challenges that we face. And one of the key ways that we can overcome that challenge is through collaboration. And so we're going to dig a little deeper this morning into what that means. Okay, so here are just some of the objectives for today's session. Again, my big goal is just to kind of share with you our process and what we did and why we did it. One of the things, for those of you who don't know, especially in the US, Deafblind Projects always commented on, well, the North Carolina Deafblind Project is so large. There's so many of you. We don't know who to call. We don't know who to contact. And so for years, we had sort of those comments. But now the tides are turning because people are saying, oh, wow, they have their stuff together. And the reason we have it, the reason we're doing it so well is because we have that collaboration. Okay, so what does the collaboration look like in North Carolina? So this is, on the left is our logo, which represents the entire project. And to the right are the logos of the three partners. So the three partners are the North Carolina Department of Public Instruction, which is where I work, and we administer the funding for the project. We have a partnership with East Carolina University, and through the university, we have consultants who go out into the field and they work with students, they work with teachers, and they provide some of the technical assistance and support that we need in our schools. And then our last partner is the Exceptional Children's Assistance Center. And this one is really important. They are the family piece. And so what they do is they can go and work with parents So helping parents to navigate the educational system, being an advocate, things of that nature. Parents, a lot of times, they get the diagnosis that their child has dual sensory loss, and they don't know what to do. So just being able to navigate all the complexities of not only having to deal with the medical side and the education side, but the family side, the social side. Okay, so I'm just going to break it down a little bit and tell you a little bit about each one. So at the State Department, we administer the funding. And so as the project director, my role is really the glue that holds all the pieces together. So we administer the funds, we provide general supervision, and we coordinate the work and then delegate it to our partners. Okay, for this one, I guess I forgot about that. So for East Carolina University, as I mentioned, they have 2 programs for students with deafblindness. The first is they have an intervener program, which for us is really critical and really important. So for individuals in the schools who want to become an intervener, the university provides them support to complete the requirements to become an intervener. And that is a statewide program. And so what happens is those individuals join a cohort. And so then they get to learn from each other, but they also get to learn from the faculty at the university. And then the university also has a graduate certificate in working with students with deafblindness. And that's also really important. This could be for any teacher, anyone who works with that population. They may want just some additional knowledge. Maybe they're a special education teacher and they have a student with deafblindness and they want to just expand their own knowledge. And then the Exceptional Children's Assistance Center, this one, as I mentioned, is really important. One of the big key things that they can do that the rest of us cannot do is, so because I work for the State Department of Education, my hands are a little bit tied in terms of what I can do with IEPs. Because let's say if a parent becomes upset and they want to file a state complaint, well, that would come to us as the state education agency. And so because of that, I cannot attend IEP meetings. So I get calls from parents all the time. And parents say, well, the school district doesn't have there's not a teacher for the visually impaired, or my child needs an intervener, or I was at this IEP meeting and my voice wasn't heard. I get those calls all the time. And they want our support. They want us to be able to help them. And I can talk to the parent, I can give them some advice, but I can't actually go attend an IEP meeting or go out into the school with them. But our friends at the Exceptional Children's Assistance Center, they can do that. And so that's when I would refer them to ECAC. One of the things that's really cool about ECAC is the advocates that work for them are parents of children with disabilities themselves. And so the parents really can connect. Okay, so one thing that we have really focused on, and this is really critical, and so this is where that collaboration piece. So now you've kind of seen how there's these 3 pieces to the puzzle. We have to put all 3 of those pieces together. We have to be one. We have to be united. And so here, I just want you to see how we work together and we complement the work of each other. And so let me elaborate a little bit more on this. So we have 2 teams. We have a leadership team. So each one of these partners has a director. And so there are 4 co-directors. So there's myself, I'm the project director, so I'm the main director. And then also where I work at the state education agency, we have a co-director. East Carolina University has a co-director, and then ECAC has a co-director. And so together, the 4 of us, we make the leadership team. And that's really important because everyone needs to be at the table and everyone needs to have a voice. And so we call them co-directors because we want everyone to be equal. Because each of us brings specific skills and expertise to the table. The second team that we have is what we call our core team. And our core team are made up of individuals from each one of these organizations, and they span from our leadership all the way down to teachers. So we have teachers of the visually impaired who serve on the core team. We have teachers of the deaf and hard of hearing. We have an intervener. We have a parent. And so the core team, they meet, well, both of these teams meet on a monthly basis. And this is really where the bulk of the work gets done. And so that's why it's really important. We have to have those monthly meetings for communication. And we have to collaborate. Because let me tell you what happens. One thing that happens when you have a large project like this, I'm sure for those of you who work in large agencies, sometimes people will call multiple individuals searching for different answers. And so someone might call me and get an answer they don't want, and so then they might call somebody else to see if they get a different answer. And so we have to all be on the same page. We have to have good communication, and we have to have good collaboration. And so to do that, we really have to have those monthly meetings, and we have to be intentional about how we use that time and what those meetings look like. So now you're probably asking, okay, well, that all sounds great. How does that actually work? Well, it's hard. It's hard work. It's hard when you have different people who have different opinions, different viewpoints. And another thing that also makes it hard is even though we are different agencies and we're collaborating, each agency has its own rules. And so trying to navigate the complexities of all of those things is really hard. Okay, so how did we do that? So what I'm going to do now is I'm just going to kind of, and I'm going to tell you, this was a very long process. I joined the project about 2 years ago, and this process really took about the last 2 years for us really to start seeing some progress. So we started with a situational appraisal, and so we really just had to look at where are we at and where do we want to go. And one of the big things that we noticed was that over the history of the Deafblind Project, we had to go back. We had to go and dig and dig and dig, and we had to figure out, well, why do people feel the way they feel? And so one of the things that we discovered was that in the past, there wasn't a lot of follow-up. People would make decisions, people would make recommendations, they would say, oh, that sounds great, let's do it, but then it would never happen. Another thing that we found by digging through the history was, okay, so sometimes those decisions that are made that I mentioned, sometimes they're just done in isolation. Sometimes it's not collaborative, and it's not transparent. And so then people don't know the why. And that becomes a problem, because then people don't understand, well, why is it that way? So we started off knowing those two things. So from the very beginning, we knew, okay, we have to establish a process. That process has to be transparent, because if we're going to get buy-in from all of our stakeholders, from all of our partners, we have to be open. And so the process that we used was very open. Everyone came to the table. We were very honest. We were very transparent. It was a respectful environment where we knew that what was said in that room stays in that room, and we respect each other as professionals. The other thing we had to do was we had to make sure there was follow-up. And so that really became mostly my job as the project director. I had to make sure that my other co-directors, that they are following up on these things. If we made a decision, well, we have to implement that decision. Or if we made a recommendation, we have to make sure that that recommendation is being followed, or if there's any additional steps that we have to implement those. So we entered it with those two things in mind. Okay, so for the situational appraisal, so one of the big things that we had to really focus on was narrowing down the issues. And so we followed this process where first we had to just name the issue. And it was a long list. It was a huge list. And that's okay. So if you want to, if you guys implement something like this where you are, just to try to build a stronger team, this is good for team building, take Post-it paper, plaster the room with Post-it paper, and just write down, what are all the issues? Okay? Then once you have a list of what all the issues are, and there might be a lot of them, then what you want to do is you want to clarify those issues. What exactly is the issue? And so this is where now we're narrowing it down. So it's like a funnel. We start at the top of the funnel. We have a lot of issues. Let's clarify those issues. And clarifying it could be, what's the cause of the issue? It could be the who, the what is the issue? Maybe the issue really isn't the issue. Maybe it's something else. Okay? So we have to clarify the issue. Then another thing that we want to make sure that we do is once we clarify the issues, we want to then assess them. So we started with that big list. We clarified them, so we narrowed it down a little bit, and now we have to prioritize. Because one thing we can't do is it's really hard, it's like quantity versus quality. We don't want quantity, we want quality. So we have to prioritize what the issues are, and then once we prioritize them, we have to come up with the next action steps. And we took our action steps and we divided them into two key areas. So the first was, what are some short-term goals? What are things that we can accomplish right now? Things that we can change right now, or within the next couple of weeks. Then we also broke it down into long-term goals. What are things that are going to take a little bit more time? It could take a couple months, could take a couple years, but we had to break it down into these small steps because, again, those next steps, those action steps that we were going to do, we had to make sure we did them right. And going back to our original, when we walked into the process, we said we have to be transparent, and we said we have to have follow-up. And so we had to make sure that our action steps were manageable. We didn't want to bite off more than we could chew. Okay, so these are just some lessons that we learned, which I think are really important. So let me try to break these down. So I'm going to skip down to communication. So one of the things that we realized was that communication was really the biggest challenge when you have multiple partners that are working together. And so we had to have systems in place to make sure that each partner knows what the other partner is doing. We also have to have a system in place so that, that person I talked about earlier who calls me and then calls somebody else, we have to have a system for that. We have to have a system for, we called it a point of entry. So even though we are 3 different agencies working together, one agency needs to be the point of contact. And so everything needs to funnel through that agency. And in this case, it's the state education agency because we administer the funding. So that is more of our external communication, having systems. Our internal communication was also really important too. One of the things that we found was that people were communicating with each other, but people didn't know what was going on. So let me give you an example. I mentioned to you that I'm at the state education agency, and then I also have a co-director who is also at the state education agency with me. And so there will be times where somebody will email my co-director, but they won't copy me on the email. And then later on, I'll find out about something, but I didn't know about it. And so that's a challenge, right? Another thing that we discovered with internal communication was following a hierarchy, right? So we have leadership and we have co-directors for a reason. And a lot of times what was happening is, I have a supervisor, and so sometimes people would just go right over me and go directly to my supervisor. And the reason that is because before I joined the agency, my supervisor was the project director. And so some people have a relationship with her because they worked with her in the past. And so, I had to work with my supervisor and say, I would appreciate it if somebody comes to you and they say, they have a question or a comment about the Deafblind Project, refer them back to me, because now I'm the project director. So just having those conversations, putting those systems in place, that's really important. The other thing, the first one here, cohesiveness. This is probably, I think, the most important one of all. So when we first started the presentation, and we had that slide where on the left was our project logo, and then on the right were our 3 individual logos. I put that there for a reason. And the reason I put it there is because 2 years ago, we focused more on the right side. So we focused on if East Carolina University offered a program, let's say they offered a training or they attended a conference, then it would be, East Carolina University, they're doing that. Or if the Exceptional Children's Assistance Center was offering a webinar, we would say, ECAC is doing that. And the language that we used, that type of language right there, divided us because it looked like we weren't cohesive. It looked like, East Carolina's doing its own thing, ECAC is doing its own thing, the state education agency, they're doing their thing. And so we were not cohesive. And so over the last couple of years, we've shifted away from the right side of the slide to the left slide, where we have one logo, and things that we do together, we say, the Deafblind Project is doing this. And then that way, we don't have that separation. And I think that has really been key for folks, seeing us as a united front. So that's really important. Okay, so next steps. So some of the next steps that I think are really important, I mentioned a few of these already. These are sort of ongoing things. So I mentioned sort of the initial process, what we did at the very beginning. Let me see. Okay. So we had, even though this was an initial process, it's ongoing. This work never stops. Because the work that we do, we always have to have good communication. We always have to have collaboration, and we have to build relationships, okay? So to do that, continuously we have to have accountability. And so how do we build accountability? So one of the ways that we build accountability into our system is during those team meetings. And so we developed, as a team, as a group, we came together and we said, what should that agenda look like? Every month, what are we going to talk about? And so we developed an agenda together. And so every month we follow the same agenda. And so then everybody knows, okay, every month we're going to have a little bit of time to talk about students. We're going to have a little bit of time to talk about administrative things. We're going to have a little bit of time to talk about updates of upcoming things. And so that helps with accountability. We use Google Docs, and so everyone has access to it. And so everyone is responsible for going in and adding their own information. And so that goes back to that accountability piece. The follow-up. A follow-up is also a continuous thing. It's something that we always have to work on. And so, as I mentioned earlier, I sort of see myself as the glue that holds everything together. And so I'm constantly, reminding folks, hey, don't forget about this deadline. Hey, don't forget about this. Let's make sure we focus on this. Let's, we had this, do you remember that email from 2 weeks ago? Did we respond to them? And so you have to be really organized. You have to be very intentional. So you have to have lots of follow-up. And then I think another key factor is consistency. So how are we being consistent with what we do and how we do it? And so let me share this, because I think this is important under consistency. So I mentioned earlier sort of how the work is divided among the three of us. And that's really, 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 really important. And here's why. Because each agency, as I mentioned, has its own rules. And so there's information that, because I'm at the state education agency, I have access to a tremendous amount of data. I could tell you what school a student goes to. I could tell you who their parents are. I could tell you the number of kids in a school district across the entire state. But my hands are tied because I can't disclose that information to just anybody, right? We have confidentiality, we have regulations and laws we have to follow, privacy. So while we have access to all this great information, it doesn't do any good to other individuals unless we're intentional about it. And so, for example, in our case, because we're one, and we have the Department of Education, East Carolina University, and ECAC, we have a cooperative agreement together. And so we can share information with them. If ECAC needs to reach out to a parent, they can call me, and I can tell them, this is mom's name, this is dad's name, here's their phone number, here's their email address. I can do that. But otherwise, I wouldn't be able to do that. And so this is one of the reasons I'm going to circle back to the very, very beginning, where I said, hey, for years, everyone always said, well, North Carolina, you guys are so large, we don't know who to call. But now people are saying, well, that's actually a good thing, because I hear this from people all the time in other Deafblind projects where they say, let's say you have a Deafblind project that is based at a university. And some of those universities have really good relationships with their Department of Education, but then others don't. And so for the ones that don't have those good relationships, getting access to student information, parent information, that's a challenge. Or if the program, let's say the Deafblind Project is based at the state education agency, having a relationship with a university or a parent training center is really helpful, because there's things that they can do that the state education agency cannot do. But we already have those systems in place, because that's why we work together. And it's formally working together. Okay, and then just my closing thoughts here, as we kind of wrap this up, is, and then I want to make sure we have time for any questions or discussion. This work is super important because we know that students with deafblindness span the spectrum. They have all different kinds of They could fall under any number of disability categories. They might just have dual sensory loss. They may have other additional disabilities. We also know that employment is a challenge. Transition is a challenge. We know that independence is a challenge. And so one of the reasons why that this collaborative work is so important is because when we are talking about each of those individual areas, identifying the student, providing services, and then what their future looks like. Well, that's what we're doing. Because all of those phases, each one of those transitions has to be seamless. I did forget to mention, and I probably should have mentioned this, so I apologize. We also, within the state education agency, we also have a program called Early Learning Sensory Support. And this is a program for kids who have visual impairments and hearing impairments from age birth to 3, which is our Part C program. So that is also housed within our agency. And so, again, big thing here I want you to take away is that because of the way that we have our project set up, where we have a collaboration between these 3 agencies, we can provide support to a student and their family literally from birth all the way through adulthood. Because we have the early learning piece, you have the state education agency at the table, you have parents at the table, and we're always working with parents. How can we build their capacity? What can they do to make sure that their son or daughter is successful in the future? And then we have the university program. And the university program, preparing professionals, preparing students. So it really spans the gamut for the work. All right, any questions? Oh, sure.
No, thank you, Dr. Chase. Okay.
Hi, my name is Tracy. I just had a question about, you're talking about the different categories. Like, do you categorize the types of deafblindness? Like, I know you talked about age and stuff, but do you have maybe some kids that are from CMV or Usher syndrome? Like, do you guys categorize it in that sort of way?
Thank you. Good question. So we collect data on any student from birth to age 22, and one of the things that we do collect is their medical diagnosis and whether that medical condition is progressive or stable, whatever the case might be. So Usher's, other conditions that we typically find that are associated with deafblindness. We try not to really put a label on it, and one thing that we have really tried to emphasize, at least in North Carolina, is that deafblindness is any level of vision loss and any level of hearing loss. And we do that because we know that there are some conditions out there that inherently, right now, maybe the child's vision is not so poor. But later on, there's a very high probability that it will deteriorate. And so we want to start working on those things. So even though right now their vision may not be a problem, let's be proactive and let's look at that. So it's any level of vision loss, any level of hearing loss, and we're really trying to focus on that, because another issue that we have is, there are, in the US, there are 14 disability categories. And one of them is called multiple disabilities. And we find a lot that instead of identifying the child as being deafblind, they'll identify them as having multiple disabilities. And what we have to look at is, does that label, does that category best represent the needs of that student? And for some it might, because you might have a student who has a hearing loss and a vision loss, and they have other disabilities. So for a student like that, having the category of multiple disabilities might be very appropriate. But on the other hand, it may not be appropriate for every student. But that's more from like the compliance side. Now from the instructional side, your question is really, really helpful to us, because our partners at ECAC, when they go out into the schools and work with students and work with teachers, we need to know that information. We need to know, well, what is their level of vision? What is their hearing loss? We need to know if there's other disabilities. We need to know the medical information, because when we're working with the student, we need to develop intervention plans. And so all that information becomes really important. Oh, sure.
There we go. And then I'll go there. You can hand it after.
Yeah. I just had a second part to that question. I was just wondering, like, we were talking about different categories and stuff like that. Do you track to see if you start to notice, like, maybe there's more students coming up with Usher syndrome or more like specifics, and so that you can match the needs to those individuals? And I just wanted to thank you for your presentation as well.
Thank you. So we do. So the data is reported on an annual basis. And so we compare the information from year to year. A lot of it doesn't change, right? Like if you have ushers, your ushers isn't going to change from year to year, right? Like the medical diagnosis of ushers. That's not going to change. But we do look at the prevalence of, okay, we have a new student that was added this year. What is their diagnosis? And if we're seeing a pattern in terms of certain numbers, then we do look at that. Unfortunately, I'll tell you, most of the data tells us that the cause of deafblindness is widely not known. For most of the students, they don't know. The bulk of them. I don't have an exact number off the top of my head, but it's really challenging. A lot of times what we find is that for our really complex learners who have multiple disabilities and have lots of other challenges that are going on, it's really hard for doctors to tease apart exactly what has caused the sensory loss. One more. Okay.
Thank you. It'd be faster.
Kristen Carlson, Perkins School for the Blind, Watertown. So when thinking about transition age students who are being educated out of state, and so their education teams are in a different state, but they're returning back to the sending district, the sending town, are there resources available for those parents to have project members support them in and out of state IEP if invited? And how does that school, the receiving school, connect for resources when students are transitioning back home?
All right, really good question. So let's think about that for just a second. So I think one of the unique aspects of Deafblind Projects is that we sort of function in silos within our state, right? But we do have the National Center on Deafblindness. And there is currently, I think it's about a year old or so, the National Center on Deafblindness has a transition cohort. And so this is made up of certain states. North Carolina is one of them. And we're really looking at those transition milestones. And one of the key pieces of that is parent involvement. So I think that's potentially one resource, is the National Center on Deafblindness, and then looking at it from a transition standpoint. And I'm thinking a little broadly, I'm not thinking transition in terms of, high school to adult life or age 14 and up or anything like that. I'm thinking, well, if you're transitioning, if you do attend Perkins, and let's say, you're from Kansas, transitioning back and forth and still maintaining relationships and contacts with your community in Kansas, that could be a challenge, right? Because we want that student, when they go back home, to to have opportunities. And so they have to have relationships and connections. So the other part of that I think is really important is working with those deafblind projects. So identifying where they are and who they are is really, really important. So even though the child attends, an out-of-state institution like Perkins, for example, their home is still that other state. In my example, Kansas, right? So it would make sense to me that if there's IEP meetings, if there's other team meetings, things like that, that you're going to want, just like you invite the parent, you're going to want to, with the parent's consent, you're going to want to invite individuals from their home state. You want them to be part of that so that when that transition happens, when they go back home, that those resources and those supports are still in place and ready to go. Did that answer your question?
It did, thank you.
Okay.
Are there any more questions? Okay, I think we're good.
Okay.
Just.
And this is my contact information, so feel free to, you can always feel free to reach out. I'm happy to talk to anyone. I'll stick around a little bit after this too, if anyone wants to chat.
Okay. Well, thank you very much, Dr. Chase. I think you certainly established why collaboration is so important, but including why it's so important to have an intentional approach and a common goal is important for the, obviously it's vital for everyone to come together and be on the same page. So thank you very much. We really appreciate your time and your insight to this morning.